Hi everybody, I'm Jen Smith. I'm going to give you a little bit more of an EPID update than a biostat update. I'm going to talk about recruitment into MGI. Just kind of giving you the big picture of what enrollment has looked like over time, starting in 2012. As you can see, we were doing really great, over 10K per year until COVID, and then COVID was a major challenge for us in terms of enrollment, and we are starting to get back on track now. We're on track for about 6,000 in 2022, and we're hoping to keep expanding that. Most of our early recruitment was through anesthesia, as Chad's group, which we call MGI ACE. And more recently, we've had other partner studies or strategic initiatives that each have their own set of research questions and diseases that they're interested in that have come online and have also started to contribute to our overall recruitment and enrollment. And I put those studies up there, they're little bubbles on the graphic. So if we look at MGI enrollment by the different types of studies over the years, the one in blue, MGI ACE or anesthesia, is about 80% of the total MGI sample right now. So that's our major recruitment site. Still is about 40% of our recruitment even after COVID. We'll probably pick back up again as we start to overcome some of the limitations of COVID. But we also have some partner studies that are starting to really contribute more meaningful numbers to our recruitment, especially my part, which is a diversity initiative. So I'll talk just a little bit about the challenges that MGI ACE experienced during COVID. So the biggest issue was that it really disrupted the clinical flow. So these are people who are coming in for surgery. Usually what we had was a recruiter who was there on site who would talk to them. And it's been really much more difficult to approach patients during COVID. So there are more nurses assigned to each patient. The surgical flow is much quicker. They don't want people staying in the waiting rooms. There's a COVID testing procedure for inpatient, which zips people away before we can kind of get to them. And we also couldn't be on site until very recently. So that was the major portion. Another challenge has really been that not everybody is approachable now like they were 10 years ago. So we get repeat people coming in to have different surgeries. And so an estimate from one of the recent months was that of the people who might be eligible for MGI, about 20 to 30% have already enrolled, and another 20% are not approachable or have declined. And so our population to ask is shrinking a little bit. However, we're now back in the pre-op space, so we feel like that's going to help us really bring up those totals again. And we're working on establishing stronger connections to our pre-op staff. And there's been a lot of innovation around different methods for finding populations. So we're going more into outpatient clinics. We just recently began recruiting in Brighton outpatient that allows us to reach new people, younger people, and kind of strategically looking at places where our U of M anesthesia is already recruiting for other studies. And we just developed a new dashboard to help MGI ACE prioritize people to ask. The other major initiative that's enrolling several thousand people a year right now is My Part. So this is a survey-based MGI partner study, which has the objective of expanding diversity in MGI. And so you can see kind of on the top in blue is the age distribution of MGI overall, and in red is the age distribution of My Part. So we have a much younger cohort there. We also have about a third of people are non-white race and about twice as much Hispanic or Latinx in that sample compared to MGI. So some major innovation that we've done in My Part has been, for example, we worked with the CBR and many other people to send saliva kits by mail rather than relying on blood draws, which has been really helpful during COVID. We're using MyChart Patient Portal for recruitment, which hasn't been done before for an observational study. Another huge thing we're doing is we figured out how to link outside records, electronic health records, to our data using an app, which has allowed us to expand outside of U of M, which previously we couldn't do. This year we're also working on a self-consent video for easier enrollment, translating the survey hopefully into other languages, especially Spanish this year, and also moving more into texting and social media-based initiatives rather than just in-person recruiting. And finally, I'm just going to tell you very quickly about an initiative in that my part sort of diversity work, which is our work in the MENA, Middle Eastern or North African population. So in Detroit Metro, we have one of the largest, most visible Arab and MENA communities in the US. And so we wanted to really work with people to sort of get that community and make it a part of precision health. So working with some researchers, both from U of M and outside U of M, we added questions that were more relevant to that population to the survey. And importantly, we partnered with this Arab Community Center for Economic and Social Services, or ACCESS, and started trying to recruit patients that way. We also used a name algorithm in our Michigan medicine database to identify people to ask to join MGI who might be of this descent. And so through all those approaches, we now have 102 participants that identify as MENA in a survey. And we have had some challenges in this area. So there are language barriers, there's difficulty in building trust, there's staff time constraints with this sort of community approach. So this year, just for this one initiative, different things that we're doing are engaging Arab American or public health student groups at U of M and other universities, partnering with healthcare professionals at U of M and other hospital systems, making new partnerships with communities and trying to sort of tweak the partnerships we already have. We also, are launching our email and social media-based recruitment too, and trying to work on securing other funding to help us really make this population, to have a great partnership with this population and be able to investigate this research in this population, which is so underrepresented in research. So that's just the quick overview. Thank you to the development working group and friends and many other people who've contributed to this. That's it.